So I just wanted to introduce myself. My name is Kyla Hill. I am a Franklin and Marshall alumnus. I graduated in 2018 with a master's with a major in public health, and then went on to get my master's at Geisinger. So I'm here with Dr. Gary. Would you like to introduce yourself, Dr. Gary?
Absolutely. Hi, everybody watching and everyone who will watch. My name is Monique Gary. I am a proud graduate of the Philadelphia College of Osteopathic Medicine, and I know we may have some folks in the conference from PCOM. I'm a Philly native, and I am a breast surgical oncologist. So I'm a breast cancer surgeon, which is a board-certified general surgeon who then goes on to do an additional fellowship just in breast cancer surgery and oncology. So I am the medical director of the cancer program at Grandview Health, which is in Sellersville, Pennsylvania, about almost an hour outside of Philadelphia. And there I also direct the breast program and the high-risk program. We're part of the Penn Cancer Network. Outside of that, I am clinical faculty and a clinical associate professor of medicine at the Philadelphia College of Osteopathic Medicine, at Texas Christian and University of North Texas Health Sciences in Fort Worth, and a clinical associate at Penn Medicine. And I am so thrilled to join you today.
So excited to have you. This next question is a bit crazy because I know there's no typical day, but can you walk us through what a semi-typical day would be for you?
Yeah, and the reality is that in breast cancer surgery, as opposed to general surgery, breast surgery is a different beast. And so it really is a bit more regular. So I have clinic, which is office hours on Mondays, Wednesdays, and Thursdays, and I'm in the operating room on Tuesdays and Fridays. So on a typical Monday, my clinic opens, it starts about 8 a.m. or so. And I'll try to get there about 7 or 7:30 so I can get caught up on paperwork and look at who's coming and look at their images. And I will see patients. Well, my schedule's about almost 150% full right now. So I will see patients every 15, 20 minutes or so, and I'll go room to room to room in my clinic and talk with patients either about the need for a biopsy, so they have abnormal imaging in their breast, about a breast issue they have, they feel a lump, about results, they have cancer, or give them pathology results after biopsies or after surgery. And I'll do that until about noon, once a week. Usually on Mondays, we have a tumor board from 12 to 1, and I'm the moderator of that tumor board. And so that's where all of the cancer surgeons can come and present their patients, and we'll have the radiologist and the pathologist and the medical oncologist who treats cancer with medicine, the radiation oncologist who treats cancer with x-rays or radiation. All the doctors are usually in a conference room, but because of COVID, we're all virtual. So we have a virtual tumor board where someone will present the patient, the radiologist will bring up the images so everyone can see, here's where the tumor is, here's this other spot. Hey, what do you think that is? Should we do a biopsy of that? The pathologist will show the microscope slides. Here are the tumor cells. Here's where it's invading out of the ducts in the breast. Here is where the estrogen receptors are staining or not staining. And then we'll kind of conclude with what we think the patient should get. What is the treatment plan for that patient? So that's usually during lunch on Mondays. And then for the rest of that day until about 5 o'clock, I'll see patients again. After that, I will sign charts. I will call companies and get insurance companies to pay for MRIs, PET scans. I'll call patients and give them their results from biopsies done 2 days prior. Sometimes good news, sometimes not so much. And I'll review for the next day for surgery, which starts about 7:15, 7:30 the next day.
Okay, so that's a day.
That's a typical Monday.
Awesome. So why medicine and why surgery?
Oh boy, I think medicine chose me. You know, I come from a family of nurses. My mother was a nurse. My grandmother was a nurse, and I love the ability to help heal. You know, and I watched. My mother had a rare illness. She had ovarian cancer, and she died at 29. And my grandmother then developed breast cancer, not once, but twice. And so I think that for me, cancer sort of picked me. And so since it did, I will dish it right back and take the opportunity to help women who have breast cancer and cancer in general, and help to empower them, help to fix things. I was always that kid that took stuff apart and got in trouble for it. Um, yeah, Walkmans and other things. And I love the ability to be able to fix a thing and help make life better in a single setting, as opposed to the chronicity of some other types of medicine. So surgery was a good fit for me because of that reason. And interestingly enough, I found that am enjoying the chronicity of seeing my cancer patients every 6 months, even after surgery's over. I still see them. We go over the breast exam. And part of the osteopathic philosophy of medicine is that the mind, the body, and the spirit are connected. And so even from diagnosis, I tell a patient, I do you no service by just removing a tumor in your breast if we haven't figured out what those factors are that are contributing to illness in your body. So what are we doing about stress? What are we doing about alcohol? What are we doing about smoking, about things that'll kill you faster than stage 1 breast cancer will? Toxic people in your life. How can we change your diet? Are you sleeping at night? What's bringing you joy? And so we get to work on all that stuff, because that stuff contributes to inflammation in the body. It contributes to stress and the turning on of stress genes. It contributes to unwellness that makes a better environment in the body for cancer. So I get to do all that, and I get to operate and cut out cancer and kick cancer's butt, so it's the best of all worlds for me.
Thank you for sharing that. I guess shifting past a little bit, what challenges did you have to overcome in this journey of becoming a Black woman surgeon? How did you get there? What are some obstacles that you had to step over?
So I wanted to be a doctor since I was probably 6 years old. And I used to watch Wonder Woman, the old Wonder Woman TV show, where Linda Carter used to spin around until she got, until she turned into her costume and she had her lasso and her jet. And I used to spin around until I was dizzy. And when I realized I couldn't be Wonder Woman, the superhero, I switched and I wanted to be a doctor. And probably since I could talk, people kept saying, "Are you sure you want to do that? That's really hard." Or, "Yeah, you don't want to do that. That's a lot of long hours. You'll never have time to have a family." Or, "You speak so well. You should go into journalism. You should be like Oprah Winfrey, or you should go on TV and be a broadcast journalist. Or, you play 4 instruments. Maybe you should be a musician." And they kept trying to discourage me. And I think many people meant really well. And this is an important thing for you to realize, is that your mentors, many of them mean well. But when there's something in you that knows who you're supposed to be and what you're supposed to do, it is your job to find your way through those obstacles to do that thing, and to not interpret obstacles as redirection that you shouldn't be that thing. And this is what we do. I was raised, by my grandparents who were on a fixed income, and we didn't have a lot of room for error. And so my grandfather said, "You got to be twice as good and you got to work twice as hard, and there is no room for failure." But I didn't always succeed. And I have a lot of failures that we could be here talking about for a really long time. I got diagnosed with a learning disability as an adult even. And there was no room for failure. So I spent a lot of time second guessing myself. I got through high school pretty well, but I don't think I picked up the skills that I needed to learn how I learn. Meaning I was bright. I could listen to lectures, I could, do a couple questions, and I could get by on exams and probably do pretty well. I graduated like second in the class or something, but when you get to college, it's a different beast, right? College is tough. There are fewer exams. There's fewer spoon feeding. The textbooks are bigger. And I struggled in college. And I worked 3 jobs. And then I got into a car accident and I almost lost this hand right here, And so there were a lot of obstacles in the way that really took away my self-esteem. And I started to listen to the voice of others and listen to my own internal voice that said, well, maybe you shouldn't do this. You shouldn't be this. And it took me many years to get back on track. I ended up teaching music for a year after college. I went into cancer research, and I started out like sweeping floors and changing mouse cages, and ultimately worked up to a master's degree in molecular biology, and decided that, I want to go to medical school. This is my dream. This is who I'm supposed to be. I'm supposed to help people through surgery, and I'm supposed to do cancer surgery. And I got there. And even then, I can't tell you the number of professors who were saying, well, you don't look like a surgeon. One of the chairmen of one of the departments of a school I won't mention said, well, get in line because, all these people want to be surgeons too, and you don't really look like a surgeon. And so that's why this shirt is so important to me. I was down at a bookstore in Philly, and these two young girls came running out, and they said, oh my God, where'd you get your shirt? Because we want to do a capstone project on Black women in surgery for our high school, but we couldn't find any. We don't know any. And now they have a capstone project with the only Black breast cancer surgeon in Pennsylvania. So it matters. Representation matters, but it's a tough road. But my point is, you got to learn to filter out the voices that don't support your mission and your fire and your purpose. And you got to do it. You owe it to yourself, and you owe it to this world to be who you believe you can be.
Do you have advice for students applying to medical school, students, pre-medical students in college, any health focus on how to overcome feelings of imposter syndrome and just how to get there in general?
Yes. So find good mentors and build relationships with them. And by find, I mean, and I guess by good, I mean, not just people who say, oh, yes, you should do that, but people who can also sponsor you. One of the things that we learned from sort of the women's movement in business and industry and academia is that mentorship is not enough. It takes sponsorship and actually the literal pulling up of seats at the table, the creating of opportunities that makes a change in diversity in healthcare and anything else. And so finding those people who are going to say, you know what, I got a student and here's an opportunity, and they'll call you and say, listen, you need to apply for this, and not let you count yourself out. Those are good mentors. I think being honest with yourself about your strengths and your weaknesses and working on those things, actively developing a plan for improvement is really important because, I sit on an admissions committee. And one of the things that we look at is we look at scores, we look at grades, but we also look to see what happened the second time. Okay, so you took your MCAT and it was marginal. The second time, what did you do? Where'd you go up? Where'd you go down? Did you go down in one because you focused and studied really hard for the other? And we understand that. But what is your plan and your strategy moving forward? Let's say if you don't get in, what will you do? How will you find your way and chart your course? Because medicine is really about resiliency. It's about learning to be resilient in the face of fatigue, in the face of racism, in the face of, being completely overwhelmed and off balance sometimes in your personal life, and having that sort of resolve and being able to strategize and having good insight is key, I think, to overcoming most of the obstacles you'll face. But you got to know yourself, how you learn, how you get better. What do you do when you fail? What do you do when you're low? And why you want to do this? You tap into your why and the stories that support your why. And the committee will be like, oh, yes, I see this. She could take care of my family member. She could take care of me if I were sick. And that's what you want to convey.
Thank you for that advice. I guess more to your life and how you find balance. I'm wondering how did you learn through different points in your career how to prioritize your health and your mental health and just any ways to find balance and wellness?
I'm still learning that. And it is an iterative process, meaning at every point in your growth and in your career, you're going to have to double down on that commitment to yourself. So I think the first part for me is understanding that it's a dynamic balance. There are times when my life is completely off balance. Like next month is Breast Cancer Awareness Month. I think I have 12 to 14 talks next month. But November, I'm taking off, I have maybe 2. And so October's going to be bananas because it's Breast Cancer Action Month. We got to do stuff. And this is the month to do it. So I'm making myself completely available for that. But in terms of balance, I think that finding the things that you love, I love music. And so during medical school, 1, out of necessity, but 2, out of love, I played the piano and I played the organ at a little Baptist church down in Kensington, down in Philly for the kids choir. And we had so much fun. The adults said, well, can you play for the adult choir? And next thing you know, I was able to make the rent playing the piano. And so I had choir rehearsal one night a week, church one night a week and, made the rent and had balance because these little kids are looking at me, Miss Monique, the lady who plays the piano, and they don't know that she's like, in medical school and studying all night long. And that was okay. And they did once I finished. And it was really, I guess it was important for them and really important for me. And so finding the things that you love, making time to do them, even in the midst of study, and especially in the midst of your hectic schedule, because that's what enables you to really tap into the part of your brain that there's a rhythm, there's a rhythm when you, let's see, how do I say it? When you're in your time and your moment, when you have prepared, when you're ready for a thing, there is a rhythm that prepares you to function optimally. And this is what surgeons do. Every day we tap into that space where everything else is drowned out and we have a thing to do, a task to perform, a tumor to remove, and we need to do it quickly. We need to do it safely, elegantly, with as few movements as possible, as fast as possible, and get that patient off the table. But that rhythm of excellence, I think, is easier to tap into when you are balanced and not in a state of fight or flight. And so, an example is I was in medical school. We were studying for the biggest exam and going over it, and I'm pacing the floors, and my friend's quizzing me, and she's like, this stuff. Why are you? What is happening? And I'm like, I don't know. I just can't think. And I said, I gotta go. I gotta go home. I need to cook, and I need to eat something that's not pizza, that's not egg rolls, that's not fried chicken wings. I'm going home. I'm going to make some dinner. I'm going to eat that dinner. I will bring you guys something back. And then I don't care if I have to stay up all night. I got to get out of here. And I left. I went home and I cooked this amazing dinner. I had a glass of wine and I put on my music and I was like back to myself, brought the food back. And I said, all right, you guys ready? Let's go. And she's quizzing me and I'm rattling them off. And she's like, what did you do? Where did you go? And it was because I got out of that reptilian brain that freezes. And so the most important thing you can do is figure out how to get into that space where you can trust what you know, because that is so much of what medicine is trusting what you know and getting into that rhythm. So find that balance wherever you can, even if it's only 10 minutes of stretching. We had one girl who would get up in the middle of everything and start stretching and doing yoga. And we're like, what is happening here? But that was how she got into her zone. So whatever gets you in your zone is what you got to do, because when it's time to go, you got to go. You got to perform. You need to do well. So figure that thing out, and you'll be glad you did.
Thank you so much, Dr. Gary, for that insight. I just wanted to open it up to the students and everyone watching. So please feel free to put questions in the chat box and I can relay them over to Dr. Gary. We have one already from Angela DeHart. She says, what insights do you have for students when it comes to the difference between studying for success in high school versus college versus medical school?
Gotcha.
Thank you for that question.
That's a great question, and it is different. So your high school years should be spent figuring out how you learn. So whether or not you are an auditory learner like me, because I'm a musician, I hear things and I have a little bit of a little photographic, little eidetic memory. So if I hear it, I can remember it. And so I'm auditory. Some people are learners such that they have to write things down. They have to highlight things, right? Some people learn by taking notes and note cards. So figuring out how you learn information the best, how you retain it, is a really important skill for high school, because that sets you up for success in college. Because in college, you've got to learn a higher volume of material with less help. Learning to ask for help in college, I think, is a really important process, because you can get very distracted and get behind very easily in college. So college is about, for me, it's about goals, it's about humility, and it's about time management, because there's nobody standing over you telling you need to do your homework at night. And so you've got to have that time management, and studying looks a lot different. It also probably looks more like community type studying with people in your major, and learning which groups of people you need to be around and which people you don't. And that will take you into medical school, because medical school is full of people who feel like they're in competition with you, depending on what school you go to. And there are a lot of sort of cultural and other sorts of dynamics where you find that some people have unfair advantages. Their dad was a surgeon, somebody's on faculty, somebody's club, they're the club president, and Dr. So-and-so is the sponsor, and like there's all these sort of weird in groups that you might not be in. And you'll look at these people and say, well, they go party all night. How do they study? And some of them do, but some of them study all night. And they just say they party all night, and they're there to completely throw you off balance. And so medical school is about your individual why. It is about forward thinking and taking the steps that will plan for success later. So when you're in medical school, you need to be thinking about residencies and about talking to different doctors from different fields so that you can see what you want to do and figure out how to get there, how to navigate a course to that career, because so much of the process on paper for medicine is random. It's lottery, like the match. You match into your specialty, you hope. But if you want to do emergency medicine and you don't match, or you're going to do family practice, if you want to do OB or general surgery and you don't match, what are you going to do? And it's not as random as you think. It is really very strategic. And so it means that a couple doctors at a few places that you've rotated. And so you got to start mapping out in your head when you're in medical school, where do I want to rotate? Who can write me a great letter? Who are the chairmen of departments and people who make decisions, because I need to align myself with them. And so that's kind of how your thinking is in medicine, because you've already mastered how you learn. You already know your why. You've got pretty good study habits. Now it's your time to shine and begin to plan strategically. So I hope I answered that question okay.
She said thank you in the chat box. So I think you answered it completely. The next question here is from Janae Easy. She said, how do you handle conflict with a superior who may be dismissive of your knowledge and experience?
Let's see. How did I handle it when I was in training? When I was in training, I handled it probably a lot different than I handle it now that I'm out of training. And so there were colleagues of mine who had been nurses before. They had been PAs. They had experience in medicine. But I think it's always important to recognize that there's room for learning and for growth. And so even if you had a former career in healthcare or law or anything else, there's still room for you to learn something in this moment from this patient, from this resident, from this physician, even if and when they're talking down to you or discounting or being dismissive of your knowledge and experience. I think your knowledge and your experience is for you. It is to strengthen your confidence in your clinical decision making and your ability to be a good doctor. I think that people will always try to be dismissive in medicine because it is very much still the culture, especially in surgery. And race certainly plays a role in that as well. So it's a double whammy. I've seen people of all races and ethnicities push each other down. The higher you go, the more they kind of really try to push you down, because they're sort of like Titans, I say. They eat their young. And it's not right. But it should not change who you are. And so the conflict, I would say, try to diffuse the conflict. Why should there be a conflict over what you know and how much knowledge or experience you have? I think it can manifest, and it'll become very apparent if you are clinically excellent and if you have knowledge that is far superior to your colleagues. I think there are ways to show that knowledge and to do very well that don't involve embarrassing colleagues either, because I've had some people who can be a little obnoxious and embarrassing about what they know. And, nobody likes a wise ass, right? Especially when you're all trying to get the job done. So I think you got to look at yourself. You got to be confident and know what you know. And if someone's trying to convince you of what you don't know, well, then at that point, you go find some references that support what you know, and you don't have to bring it to that person per se, but just reinforce who you are, what you know, especially if they are your superior, because that then can create a dynamic that says this person is not easy to get along with. This person doesn't know how to respect the hierarchy of this profession. And it sets you up for that person to then talk about you and badmouth you to others. And you'd rather be the person who knows what they know. You can let so-and-so do whatever it is that they're doing and just be right to yourself, be right to your patients, be right to your colleagues. And in medicine, the absolute bottom line is always do the right thing for the patient. And so if a superior is telling you something that is wrong, that will impact patient care, well, at that point, it's different. Then you have an obligation to stand up for the patient. And that means talking to your direct supervisors. That means talking to your chairmen, your program directors, your whomever, But if you're going to do that, you've got to be sure of what you know and that someone is telling you to do the wrong thing. So I think that's a different line. Otherwise, people are going to try to make you feel bad all the time. Your knowledge is for you so that you know that you are doing the right thing, so that you can answer confidently on questions, so that you can take good care of patients. And their problem with what you know is their problem, not yours.
In the chat box, she responded, "Thank you. That is definitely helpful."
Yep.
The next question is from Samiles. She said, "Do you have any advice in finding a mentor? How do you approach them and not feel like a nuisance?"
That's a really good question that I used to ask when I was a student trying to find mentors and not be a nuisance. And now I'm a mentor who needs students who are nuisances because my schedule is so busy that and probably a couple people watching are folks that I mentor, and it with varying degrees of success. And I do support you all, and I love you, and I will write you a letter, and I will even make a phone call because I believe in sponsorship. But you might have been texting me, and I might not have gotten back to you yet. And that's this life. And so finding it depends on what you need. And I think you also have to recognize that you probably won't have one mentor for everything. And so your job is to figure out what you need a mentor for and get that specific thing from that person. And recognize that you will have an entire cadre of mentors. You'll have a whole soup and a stew of mentors for different things. But if you put it all on one person, you're probably going to be disappointed. And they're probably going to feel like a failure and stop communicating with you at some point. And so the goal of mentors are to help support you in various aspects of what you need. So if you need a mentor to help you write something, to publish something, then that's a mentor for that. If you need a mentor to help you, with your application for something, that's a different mentor. If you need somebody to help you sit down and figure out who you want to be and why and do like career guidance and counseling, that could be a different mentor. So I think being strategic about having a goal in mind when you talk to a mentor is much better than sort of the random, I'm just checking in, how are you doing kind of conversations, because at some point I think it's nice, but you got to tell me what you need. So if you want me to write you a letter and we haven't really worked together, then I need you to tell me what goes in that letter. And I have found that the best successes that I have had are when I have given people the bullet points of what to say about me. So at the end of a rotation, for example, I'll say something like, this was an amazing rotation. When I started out, I thought I was going to learn this, this, and this, but I actually learned this. I learned that. I was able to show growth in these ways. And guess what ended up in my letter? She showed growth in these ways, and she excelled in this, and she learned that. And like, you got to tell people what to say about you. And I used to think it was obnoxious and a little bit kind of misleading, but it's not. If you just say, hey, can you write me a letter? It's going to sit on somebody's desk because they have to now think of what to write about you. They got to remember who you are. You got to remember your favorite color was green. I mean, you got to help people help you. And that is probably one of the most important things nobody tells you about that relationship, is that if you need something from a mentor, be specific. I need help with this thing. And then when they don't get back to you, say, is this the best way to communicate with you? Or what's the best way to communicate with you that doesn't feel too, obnoxious or intrusive to you? And asking that question directly. Chances are they'll say, listen, just text me. Or at this point, I'm at the point now where if you need something from me, you got to give me a date and a deadline and probably put it on my calendar. Send me like a Google Calendar invite, because then I will see it on my calendar and I'll say, oh, I have a call with Jasmine tomorrow. As opposed to, hey, can I call you? Or, okay, that's great. So I'll call you at 1:00. If it's not on my calendar, I'm getting a little bit behind with things. So figuring out that is going to be super important for mentoring. Maximize those relationships, diversify those relationships. And you have more than one, because everybody's not good at everything.
A follow-up question about mentorship. Grace Bowman, she asked, she's a high school senior, and she wants to know at what point should she begin her search for a mentor?
Let's see, high school senior now. Yep, go for it. Because your mentors when you're in high school are going to be mentors in college, mentors in graduate school, mentors in medical school, and also professional mentors. So you should have mentors at every level of where you're trying to go. That way you can have somebody to reach out to who isn't too far removed from the college experience. You ask somebody who finished college 20 years ago, well, their experience is likely going to be a lot different than yours. And the process even to get there may be very different, so I think now's a good time, because what you find is that you begin to practice those relationships and those communications so that they feel more natural, and you're not just writing every time you want to ask something, but really kind of through your ask and through your engagement, you're showing who you are and how you're learning. It's not just, hey, can I get a letter? Hey, can you make a call for me? Hey, can you? Not that type of relationship, but it's where a person can see, you know what? I met you at the Diversity in Medicine conference, and it was so great to hear your talk and to speak with you. Do you have a half hour so I could run something by you about this? And then a year later, if it's that long, hey, listen, thank you so much for that conversation. I was able to get that internship and do da 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 da. Now I'm looking forward to this thing. Do you have a half hour maybe again, and I can sit down and show you where I'm going with this and run my personal statement by you? And then they see that they're helping you get somewhere. You're not just calling when you ask, you're not just asking for something all the time, but it can then develop into something more, where maybe you meet for coffee. Maybe you have more of a relationship than just the thing you need. But it is always, I think, important to be specific about what you need with mentors.
Yeah. Our next question is, do you intend or now serve on a board of directors? What is that experience like for you?
So it depends on what type of boards, because there are for-profit boards, of which I'm not on any of those yet. I am a member of nonprofit boards. And nonprofit board involvement, I think, is it can be rewarding. It can also be a little overwhelming. And it depends on what the organization is. So I'll give you an example. I am on the nonprofit board of the Cancer Support Community of Greater Philadelphia. I am a member of the board of directors for the American Society of Breast Surgeons as the chair of the Young Surgeons Committee. So that board membership is sort of de facto because I'm the chair of a committee. I'm also on the board of an organization in Philly called Babashi, which it stands for, it used to stand for Blacks Educating Blacks about Sexual Health Issues. And so through board involvement, they probably have meetings once a month. They used to do them in person, but thank God because of COVID, they're all virtual, because that helps me quite a bit, because then I don't have to drive from Sellersville all the way into, North Philly or wherever the meeting was, because that can jam you up. It's an hour plus, rush hour traffic. Now I've got to look at my time. What time does my clinic end? And, what time's my surgery the next day, and all those things. So board involvement, I think, is it is important, because we need to have our voices represented in places where decisions are made for community health. I think it can help us to repair the relationships between the medical community and the community. But I think you have to also understand that it is a commitment, and that people want people on their boards, because especially nonprofits, they look to board members to fundraise. The purpose of the board for a nonprofit organization is to raise money and to provide governance. Raise money first, provide governance second, usually. And so that means they're going to be looking to you to make donations, to call your friends, to invite them to this, to sell a ticket for such and such. And so knowing that, pick your boards carefully. Each board has what we call a give-get, an amount of money that you must either give or get in order to fulfill your board obligation. And that could range from $50 or $500 up to $2,500 a year that you're responsible for helping to fundraise on the part of that organization. And that's why they selected you, because you're in medicine, you're a physician, you're a whatever. You bring prestige to that board. You bring some maybe clinical judgment, but they want you to help fundraise too, because it's a nonprofit entity, and the nonprofit funds right now are drying up. So that being said, I do love being on boards. Let me say it that way, because I don't want to make it sound like I don't like being on boards, but don't do too many, because everybody's going to ask you at some point, because there's so few of us in medicine and us in leadership and us on boards. So pick the things that align with the stuff that sets your soul on fire, and the things that matter to you, stuff you won't mind doing, projects you won't mind taking on, galas you won't mind putting on a nice dress and going to, and the other ones maybe not so much.
Thank you for that. I encourage you to keep asking questions. We still have about 10 more minutes before we have to wrap up with Dr. Gary. So as we wait for questions to come in, I'll ask, how has COVID affected your daily life in terms of your work and what you do?
Oh, that's a really good question. So personally, I have seen COVID-19 impact many physicians, and in different ways. Some of my physician friends who are in critical care and others are burnt out, and they have watched, people die without their loved ones nearby. And it is very much, it has been and continues to be very real. And it's important for you to impress upon your patients and your family members, et cetera, that, it's not just this, flu that's going to pass. This is something different. And it may not be the last time we see something like this. And so you got to know that it should be taken seriously by everyone. And so, so I've seen physicians have a tough time emotionally. There's been a lot of burnout, depression. I have seen some physicians with a significant loss of wages because they're not able to do the things that they had been doing, like plastic surgery. Well, elective surgeries for a while were stopped. So, you're not doing facelifts. You're not doing, tummy tucks. You're not even doing breast reconstruction after cancer. In some places, they stopped that too. And so that is a loss of wages. I've seen some breast surgeons lose their jobs even. But from a personal standpoint, I had been able to operate through COVID. I kind of did a little campaign, and I had a hashtag that said #cancer doesn't quarantine, and it took off like wildfire, and ACS picked it up and a couple other places. And I convinced my hospital also that breast cancer surgery wasn't really elective, and it was only elective until your family member had breast cancer, and then you'd be wanting to get surgery right away too. And if our hospital and health system wasn't saturated with the coronavirus, we should continue to operate until such time as it was, because we didn't know how long that was going to last and what was going to happen afterwards. So pretty much throughout, I was able to at least get basic breast cancer surgery done, not so much the reconstruction. But what we have seen across the country is that the rates of advanced disease are starting to climb because people didn't get mammograms. They might have felt the lump. They, kind of, same thing for colon cancer. We're estimating there are going to be about 10,000 more deaths from breast and colon cancer, more locally advanced disease. And I've begun to see that in my clinics. My clinics are swamped now. We're busier than ever because of all the people who didn't get seen in March, April, and May. Now you got your screening mammogram in August or September, and now there's a lump. And now you need an ultrasound. Now you need a biopsy. And so I'm seeing these people. Personally, it has affected me in that I wear scrubs every day to work now, where I used to wear my heels and my shoes and my cute stuff. I don't wear anything cute. And everything I wear can be washed and bleached. I'm very vigilant about hand washing. I'm very vigilant about being social. I'm not a social butterfly. And not that I was one before, because I'm a little bit introverted, but I'm even more vigilant now because poo-poo on me for bringing something to cancer patients because I feel well and I decided to go out. So I have really limited my social interactions throughout the fall and throughout the summer and the fall. And I feel okay about that.
For giving some insight onto what's going on right now. We got a lot of questions coming in here. So one question is, how did you navigate in the beginning of your career with surgery being a male heavy field? Mm-hmm. And are you a mother as well as a surgeon? If so, how do you balance that?
Got it. So one, I'll start second question first. I am not a mother. And if I were, I imagine it'd be a slightly different dynamic because you do need, I think, a bit more help as a parent in surgery. You need families to support you. You need another parent. You need friends. You need a partner. You need resources to call upon because the schedule can be variable. Although, as we said earlier in the program, breast surgery is probably one of the more reliable schedules, so to speak. There are some breast surgeons who take general surgery call. I do not take general surgery call. So my surgeries are in general scheduled. The ER may call for a post-operative issue, but I'm not getting called by the emergency department every weekend. I'm not doing surgery on weekends. So the other part about it, though, is about this male dominated field. It continues to be so. Less than 2% of surgeons are Black women, and less than maybe 5 to 10% are women at all. And that number's changing, I believe. So don't quote me on that number. But how did I deal with it? At first, I felt the need to sort of overcompensate for it, and what I mean by that was be the person who goes all in all the time, volunteering for everything. There's a surgery going late, I'm staying for it. There's a surgery starting early, I'm staying for it. There's an extra something, I'll do that thing, especially as a student, because as a student, you want to perform and you want to impress upon your mentors, which are probably men, that you have the stamina it takes to become a surgeon. I think we're seeing that less and less, and it's more about strategy than stamina, I have come to discover. And so what I mean by that is finding a great research project, doing a great case report, showing what you know in a really good surgery with somebody who makes decisions about residents and things can get you further than just being a workhorse. That is not a great strategy, although it is still an effective strategy to get into surgery or to impress on rotations. I'll say it that way, to impress on rotations. I learned to tune it out because I've always been in male-dominated things, meaning if you're in STEM, you're in math, science, engineering, you're already in male-dominated places. I played the trumpet. I was the only girl in the all-city jazz band. I'm used to being the only girl. I went to an all-girl high school. And so being the only female, person there it didn't faze me as much. And I kind of sometimes like being the underdog, because let people count you out and they'll be very surprised at what you know and what they don't think you can do. And then you can always over deliver because they didn't expect much in the first place. So I use my underdog to my advantage. And in surgery, I was the only Black woman to finish this residency program where I went. It's still in 60 years, the only Black woman to finish at this residency program. And all male residents. And I just use it to shine. I use it to connect with patients. It always stood me apart and I couldn't hide it. So I use it to my advantage. It made me become really confident in what I know. And what I mean by that is you can't shrink. There's nothing to blend in with. So the imposter syndrome that we have, that need to want to shrink to sort of fit in, there's nobody who you can fit in with. And so you have to learn to find your voice and to trust your voice and to know what you know and be confident in what you know and know that if you don't, you know how to find the answer. You know how to look it up. You know how to be resourceful. And that has served me well because where I practice now, I'm the director of the breast program. When I got there, I was the only female surgeon on the staff too. And I had to sit at the head of the table and run this meeting with a bunch of, older white guys with white hair who are all sitting there like this, like, why should we listen to her? And the reason is because they invited me here to be the expert, to be the person who maybe has a dissenting opinion, right? They invited me to be different, not to be the same. And so taking ownership of that fact and knowing that your voice has power, your story has power, your difference has power, and it matters. Like who you are, you have to bring all that into the room with you. You can't just say, I'm just going to be a woman today and not be a Black woman, or I'm just going to be a Black woman, but I'm not going to be queer, or I'm a Black queer, I'm Christian. All of it comes in the room with me, and it informs that experience. And it makes my voice have all the power because all the people I am are right there.
Thank you. That was really, really helpful and inspiring. The next question is, what does your surgical team look like? The person asking, she said she had breast surgery and her team was all women and she loved that. How did you choose your team?
So I guess in my hospital, my team is a little different because it can vary depending on what day I'm operating. So I don't always have the same team. So because they rotate, their schedules rotate. But I have worked with enough of the surgical folks at my hospital, and I assume, let me say it this way, my office team is the same. So my nurse navigator, my nurse practitioner, the people, my medical assistant, we're all the same people, and they all have the same philosophy that I do, which is that patients come first. Nobody leaves until everybody understands what's going on. Your questions are important, even if you think they're stupid questions. They're still important because somebody else has probably asked the same question that you have, and that it's okay to fall apart, especially if you get a diagnosis of breast cancer. But having a support team behind you, I tell my patients, all right, it's like the mafia now. You got people, you got a social worker, we have a financial navigator, you have a breast navigator who's going to make your appointments. You have, all of these people to do things on your behalf, but you shouldn't feel like you have to shoulder it alone. And so that team's great. Now, on the surgical side, it varies, but my OR people know that there's certain things that I do. For example, when I get into a room, there should always be a warm blanket on the bed that the patient's transferring to, because Dr. Gary says everybody likes a warm bottom, right? Nobody likes a cold bottom. Nobody wants to climb over onto this ice cold hospital bed. Put a warm blanket down. It's a little thing, but it's a big thing to me. It's a big thing to patients. They know that before surgery, I will always go see the patient, answer their questions. I'll kind of rub their feet a little bit. And the last question I'll always ask after everything else, you guys have any more questions? No. I say, okay, well, I have one really important question for you. You ready? This is like the most important question anyone has asked you all day. Are you ready for this question? And they're like this, like, oh God, what is she going to say? And I say, okay, what kind of music do you like? And you should see their face, even through the mask. They're like, oh my gosh, and I play whatever music they like, which has been really interesting, whether it's Southern Baptist. I had somebody ask for death metal. I had a young white guy from Coopersburg, Pennsylvania, population Black people like one. He wanted to hear Tupac Shakur. I was like, oh, all right, we're doing this, And so you learn that people are people. And so my OR staff will always say, okay, Doc, what are we listening to? Because I'm like the DJ. What are we listening to? When it's Friday, I play Friday music. If it's Black History Month and I want to play Curtis Mayfield, guess what? Y'all getting all this Black history today. And so they roll with it. They like my authenticity. They like the safety of the room that says if something is going wrong, someone should say something. I don't run an operating room full of fear where nobody should say anything. They will always do the right thing for the patients, and we should have a good day. Like, this is a day we get to kick cancer's ass and get this person home feeling better about their lives, and you should feel better about yours, and let's do it quickly so we can all get out of here. Boom, let's go. And that's the kind of day we have in the OR,
That's awesome. Our next question is, organizations, research projects would you recommend students interested in oncology to get involved with? When did you decide on your specialty?
Probably since I was like a kid, I always knew I wanted to be a cancer doctor. I didn't think I could do it, and I had completely counted myself out in my general surgery residency when I didn't match for surgical oncology fellowship. And that's the thing you should know, is that you will not always succeed. You will fail at various things at various points in this process. And failure is about redirecting your efforts. Failure teaches you how to study differently. Failure teaches you that, okay, this method didn't work. It doesn't mean that this thing isn't for you. And I think that's probably one of the most important things that you need to get from this, because people will tell you, well, you failed, you shouldn't be this. And, you shouldn't be a surgeon. You shouldn't be a whatever. And that's probably not true. It just means that you need to reevaluate how you processed and derived those answers, or what you did different, and do something differently. But to the question about, was it about research? Yes, that question was about
Education.
Got you. So it's as far as okay, there we go. Organizations and interested in oncology. When did I decide on my specialty? So yeah, I decided early on that I wanted to do cancer, and talked myself out of it, and then ended up I scrambled into a breast surgery fellowship. I was getting ready to finish general surgery, hadn't matched for surgical oncology, had interviewed across the country for hepatobiliary, which is liver pancreas. And I said, well, I guess I'll do liver pancreas surgery and try to just do cancer surgeries for liver and pancreas. And you can always, as a general surgeon, tailor your career into whatever niche you kind of want. So I could be a general surgeon who just does breast stuff, but most hospitals now want doctors to have a fellowship in something if you're only going to do that one thing. So that being said, I called the match people. I said, hey, were there any breast surgery fellowships that didn't fill? And the reason I said I wasn't going to do breast surgery fellowship initially was because it would have limited me to just breast, and because all my mentors were male and they all said, oh, you're going to be the boob doctor. And I was like, no, I'm not. I'm going to be doing complex cancer surgeries, livers and pancreases, until I'm dead, like till I'm 90 years old and I literally fall out at the end of my last surgery. I'm going to walk out of the operating room and have a heart attack and die. Like, who wants that life? Apparently I did. I thought I did, right? Because of all my male mentors who were like, yeah, she's going to be the boob doctor. And guess what? Now I'm the boob doctor who runs a cancer program, who works at like 8 to 5, who has no call on weekends, who, like, you know, my patients go home. They don't stay overnight too long, you know, maybe one night, maybe two. But, you know, my life is good as a surgeon. And I never thought it would be this good. And as a person whose mom died of ovarian cancer and a grandmother with breast cancer twice, what else should I be doing but running high-risk programs and talking to people about their risk for cancer, right? Developing programs to help people, you know, people who could be me one day. I'm high risk. And so finding things that, you know, so to the question about research, deciding on research is a personal thing, but you should decide something that excites you or at least interests you. If you have no interest in Drosophila and the research somebody wants you to do is on fruit flies, you might not want to do it. The second barrier or question you need to ask yourself is this going to result in something publishable? Because many researchers do much work, but not a lot of it gets published, and not a lot of it gets published in a timely fashion. If you're only there for a summer, what can you do that's already on its way to publication? What can you do that can be tidied up in 3 months or the 1 year or whatever period of time you have? So look at your time and find projects that match the amount of time that you have so you can have something to show for it. Because research can go on for years and years and years, and you will have no publications out of it. And publications matter. Publications matter. The experience is great on your CV, but the publication matters more, even if you were only there for 3 months. So find publishable projects and mentors who think like that. And if somebody says, you know, I got a great project for you and we're going to get ready to do a poster on this, that's the one you want. Okay. Organizations, SNMA is huge. Anime is huge. For oncology, there are various organizations for oncology. But I think for surgery, the Society of Black Academic Surgeons, SBAS, is a really great resource full of Black surgeons, many of them academic, many of them have research projects, many of them have been mentors in the past. So SBAS is a perfect place to go because there are oncologists, there's trauma, there's everybody, and they're Black and they want to support. They, you know, this is the pipeline, and they know that they're at the top of the ladder, and they're reaching back to try to bring in students, try to bring in residents. So I think that's a great resource for everyone for oncology and other. And then look at your local schools and your local hospitals. There's plenty of oncology clubs and other organizations that you can become a part of. I'm a member of the Society of Breast Surgeons. I don't think we have a whole lot for high school students or for residents. Yes, there's always a resident competition, but finding a breast surgeon or an oncologist that you want to be a part of. And who is it? The American College of there's an oncology one as well. So definitely look at that too. Okay.
So Dr. Gary, we are a bit rushed on time, but I wanted to thank you so much for carving out time to meet with all these students and doctors and professionals and everybody who's here. You really touched me. I know I'm not alone when I say you touched me with the words and encouragement and advice, from mentorship to how to overcome imposter syndrome to how you find balance. I just wanted to thank you from the bottom of my heart. This was an amazing time. So thank you.
Well, thank you for allowing me to be here. I did put my email address in the chat. And as far as the question about negotiating and all those things all relate back to knowing your worth. Know your stuff, know your worth. You will not be able to negotiate until you become an attending. So don't try to negotiate as a resident. But do research and do research beyond your step. So where you are now, you should be researching 2-3 years ahead. And if you're just starting to look at, you know, even if you're starting your first career, you need to be looking at what's my next move going to be? And is this current career, or is this current job going to get me there? And so always be thinking forward, know your stuff, know your worth, and sit with that in a place that doesn't make you feel like you have to do anything but be you, because you're excellence. We are the descendants of those who chose to survive to come here to this country. And there is such greatness in you that no one can take away from you. And you shouldn't take it away from yourself either. So go get them. That's my advice. God bless you guys.
Thank you again, and have a great rest of your afternoon.
You too. Bye-bye.